very much, Ben.
Se retrouver ensemble aujourd'hui autour
We're delighted to be here with you today
pour construire
to
ensemble
talk about this concrete European project to build together a more preventive European society.
Merci beaucoup aux petits frères des pauvres.
Thank you very much
Si
to
vous
the
voulez,
Petits Frères des Pauvres for hosting us. I'll give you the floor for a few words. Good morning, Daniel Prévost. I'm Vice Chair of the Petits Frères des Pauvres Foundation, owner, together with the Petits Frères des Pauvres Association of this beautiful building, and we want it to be open to all. We have nice equipment here, so let's be selfless and share it with people like you. Siel Bleu is an important partner for us. We've been working hand in hand for several years. The foundation supported Siel Bleu at its inception. So when I see everything that you do on your website, I'm proud that we were able to contribute to that. So we are also proud to host your conference here this morning. I will stay with you a bit this morning, then have another meeting. I'll have to leave, unfortunately. But in any case, congratulations. And you will have Barbara taking the floor on international development later on.
Merci beaucoup.
Thank you very much.
Du coup, tous ces projets concrets et ce projet particulièrement de Moov&Smile
So concrete projects.
nous permet de donner accès à la
This
prévention à des publics
project in particular allows us to give access to prevention to fragile audiences. Through our projects, we defend a non-lucrative model of healthcare. We defend access to healthcare for all. So that's what we are going to focus on for the first hour. Our projects, our partners, our participants in the European countries. And then we want to open up the floor to other kinds of prevention, other forms of prevention that exist, to feel better, to feel well, and to be together. So we call this an anti-seminar because we also want to have active breaks so that we don't just sit there for hours and hours. Without any further ado, I'll give the floor to Jean-Daniel and Jean-Michel, the two founders of Siel Bleu, for a brief introduction. Thank you. Good morning, one and all. Thank you for being here. First of all, we'd like to say a big thank you before we start. Thank you again to Petits Frères des Pauvres for hosting us in this beautiful room. As was said, our organizations share many values. So that's very consistent, and it makes sense to work together, and that's important in Europe today. Thank you to our team as well, and not everybody's here, but thank you to the entire team for spending so much time preparing all of this for the past 3 years. Thank you to all of our colleagues from the respective countries that are here today. You've done an incredible job. So we thank you for that, because we have our white paper now, which will have a role to play in the history of prevention in Europe, and I hope that it will give ideas to some, and that will be thanks to you. And again, well done for organizing this conference this morning. Another example of the exceptional work that you do. So thank you very much. We are experiencing troubled times, so I think it would be good for everyone to take a look at books, go back to a bookstore and take a look at a history book. Let's talk about life. Gustave Flaubert used to say that the future is concerning and the past is holding us back, and that's why we can't live in the present. So today, thanks to all of our activities, we want to make that present lively, and we also try to build the future. That's why you'll see to what extent it's important to have a preventative future for a brighter future tomorrow. It's fundamental. Today, the economic issues are very crystal clear, and they are also, first and foremost, environmental, ecological issues. And there's no prevention in any field. We don't want to invest in a brighter future because we know that it's going to be more expensive for everybody. And of course, the economy isn't the only thing. Our daily lives are going to be transformed in the future. So prevention has a role to play. It's fundamental. First of all, economically, because we mentioned it. We've done this work thanks to the European Commission. And we want to underscore that because public authorities don't often help us. But thanks to the European Commission, we were able to roll out this project in several countries. And I also think our colleagues who couldn't be present here today, colleagues from different countries. So prevention is an issue and it's not taken into account enough. Let me give you one example, a very simple one. We've been working on this for years. In France, if we were to invest 10 million euros on prevention for and support for people in nursing homes, we could save every year, according to public authority studies, at least 470 million euros by investing 10 million. So economically, the figures are clear. And we would also, first and foremost, bring life and happiness, smiles to people's lives. We got new testimonies again today from people who are supported every day, and they keep telling us that it changes their lives. They can now live again. They can be active again. And that's, of course, key. It also creates jobs. In France, nearly 1,000 today through our non-profit. It also creates jobs in other countries. So it's a virtual circle. And not enough people today are open to that and are open to realizing that. So I hope that our white paper is going to lead to a more preventative Europe with a stronger commitment. This was only the start. In the future, we want to scale up, not only here in Siel Bleu, but also everywhere else in Europe, with a more preventative European society, a more welcoming society, a more fraternal, brotherly society. So that's what we want. Want to bring smiles to everybody's lives. We've been fighting for that for the past 8 years. It's been a while, but nothing's changed. Still the same struggle, still the same fight, even though the society has changed a bit. There's a bit more openness. I remember when we went to nursing homes 27 years ago, and we explained that we wanted to have projects with people in these institutions. People laughed at us. They said, "Oh, we have people in the wheelchairs and you want to make them move. It's ridiculous." But now people realize that it isn't ridiculous. It's actually of the essence to support these people to be more active. I won't be taking the floor for much longer because I need to give the floor to Jean-Michel, and we know that he could go on for a while. But I just wanted to say that we are delighted to be here with you, and we're delighted to also welcome people online. It's important to have you with us as well. And hopefully that's only the start. We just launched a campaign on big victories with small steps. And I hope that we're going to be more impactful, that we're going to change society's perspective on the health system, on that whole ecosystem. Prevention is taken more into account now, Things have started to change, and I hope that all of you and everybody else is going to keep working in favor of a more smiling society in the future. Thank you. I don't have much left to say. Thank you very much to all of you for being here, first of all. Thank you very much also to the colleagues who have been supporting this project for the last 3 years. It's quite an incredible project in France, in Belgium, in Ireland, in Portugal, in Germany, in Spain. Jean-Daniel finished on smiles. Well, Smile has been the core of Siel Bleu for nearly 27 years now. It's not only on our logo, it's part of our DNA. If you're not Siel Bleusians in this room, if you're not part of the organization, you need to be aware of one thing. Our real wealth is the people whom we're working with. They are incredible professionals, full of humanity. Hi, Caroline, please join us. And we talked about smiles, and we are experiencing troubled times. There was one person called Deleuze, created at Vincennes University at the start of the 1980s. He organized his first conference by saying that the system wants us to be sad, so let's be happy to resist to it. I think that is cross-cutting in our history. Let's be happy, let's be joyful, let's bring joy, life, health. When we talk about health, it's health in the wider sense, according to WHO, mental, physical, and so on. We don't want to describe people based on their based on their diseases. We are first and foremost a human, and that's what defines us. Now, perhaps one final word. To quote Apollinaire, I know that some of you have heard it time and time again, but what Apollinaire said will probably resonate in these serious times of our society. Apollinaire was a poet born in Italy with Russian citizenship, and he fought for France, lost an arm, and he didn't fight for borders, but for convictions, an ideology, a way of seeing life. And he wrote these two magnificent sentences. He said that darkness is never going to defeat light. Let's be surprised by evenings and happy in the morning. And that's what I can wish for all of you. I wish all of your mornings to be as beautiful as the mornings of Apollinaire, and then life will be worth it. Thank you very much. Thank you very much to both of you for putting the most important things at the forefront. Now we have a video by Diana. Diana, who is working at the Employment, Social Affairs and Inclusion Directorate General of the European Commission.
Good morning. I'm Diana Eriksonaite from the European Commission, Directorate General for Employment, Social Affairs and Inclusion, working in the long-term care team. Thank you for the opportunity to say a few words about the EU-level context, EU-level policy on long-term care, to set a bit of a scene for the project that you are going to discuss today. Let me share a few slides. Bear with me, and sorry for this interruption. It just shows that this video is not generated by AI. Hopefully you can see now. So long-term care as a policy area is relatively new on the EU agenda. but its importance is increasing, especially fueled by all the stories that we heard and saw happening in Europe during the COVID pandemic, but even before that, looking at the aging of the population and its impact on care and care needs, and the ability for the workforce to care for people in need of care. That's why in 2022, the European Commission adopted the European Care Strategy. It came as a policy package with a communication setting the narrative, the vision on care for the European Union. It covers care in a lifelong approach, looking at childcare and long-term care. The package came with 2 proposals for Council recommendation, one on Barcelona targets covering childcare and one on long-term care. Both proposals were adopted by the Council in December 22. The care strategy set a number of EU-level actions on long-term care. I'm not talking here about the childcare, just long-term care. They cover different blocks, building blocks. We looked at services, and the main action here is, of course, the long-term care recommendation, but we have technical assistance, international cooperation with the WHO, World Health Organization, to develop a self-assessment tool on long-term care policies for member states and regions to use. We work with OECD to look at the adequacy of social protection for long-term care. We have different projects, research projects, via Horizon Europe, Digital Europe. We also talk about workforce, looking at working conditions, skills, the need to attract more workforce to this difficult sector and then alleviate the life of carers, both formal and informal. We talk about the need for more data, for better data to understand and help shape better all the policy interventions across the EU, and we have a number of actions on this. And of course, we talk about the need of funding, and this sector has been is struggling in every member state and across the world to attract public funding. That's why we need innovative solutions as well as more funding. And we need to focus on prevention to prevent the development of long-term care needs, to prevent those long-term needs becoming more severe. And that's why this project that you will be discussing today is very important in the EU context. Let me say a few words about the Council recommendation on long-term care. It asks member states to take action and gives guidance structured in a number of building blocks, looking at the affordability, looking at the adequacy of social protection for long-term care, looking at the availability of services, that there are enough services to meet the long-term care needs, and then there is enough variety and flexibility of these services to meet different cases of long-term care needs. We talk especially about the need for more quality, for better standards, for focusing on outcomes, which we express as personal autonomy, ability to live independently, and the quality of life of people in need of care. And here again, this project can contribute a lot. We talk also about the need to care for carers, so that they have proper salaries, the good working conditions, that occupational and health standards are applied to the care sector, that there are upskilling and reskilling policies. We also talk about the need to support informal carers, family carers who carry the huge burden of caregiving and at the cost to themselves, to their own health and well-being. So this is a recommendation, as I said, adopted in December 22. Since then, member states have been engaging with their national level stakeholders, looking at their policies and trying to see what measures they need to take at national, local level in line with these recommendations. We have a major milestone this month. We are expecting member states' reports on measures taken and planned on this recommendation, which are due in June 24. We are engaging with them. through a network of long-term care national coordinators. Each member states have appointed their coordinators. They are available online on our Europa website. So if you would like to engage with them for your respective countries, please have a look. We organize mutual learning and we work on indicators to help monitor this recommendation. Now, a few words about the EASY project, which started before the care strategy, even before COVID. The call for proposals for projects to design social innovative models or to test innovative models or to try to upscale social innovations already proven functional in some member states to other member states. The call for proposals was launched in 2019 before we even knew what COVID is. The projects and a lot of projects were submitted, 7 were selected for funding. The project started during the first restrictions, which were very difficult, very severe, but they persevered. And we are very happy that most of them have now been completed with positive and very promising results. The Moov&Smile project is the last, I believe, to be finished. And this is the event to celebrate the achievement of this project. As you can see on the screen, the projects cover different areas and different member states and regions. They look at person-centered care via adapting services to home care services to individual needs, like in the rural care project. They try to establish social service centers, like in Slovakia, ICCC project also, to integrate health and social services. They look at personal budgets for long-term care. The unique project does that to help again integrate and adapt social long-term care to personal needs. And they look at participatory practices and policy design in care projects. And the Moov&Smile project, for us, it covers the preventive branch. It helps to design ways and to test ways to help prevent decline and improve personal well-being. And we hope to see very interesting results in the white paper to be presented today that we can later use and can promote and upscale across other EU member states. So I hope that the event will prove to be very interesting and very inspiring for you all. I'm sorry not to be there, but I will try to follow online, and I hope and wish you all the best and have fun. Ingrid.
Thank you very much, Diana. And if you hear us on the other side of the screen, we hope it's only the beginning of a very long engagement with the European Commission. Now, I told you that we wouldn't just sit, so we have Corinne and Stéphanie from Siel Bleu in Belgium, who are going to give us a little boost to help us depart from our sedentary habits. Okay, it's off mic, but the interpreter will do his best. So let's first try and stretch ourselves. Let's stretch a little bit. So you need to bring your elbows closer to your body. So raise your elbows, breathe in, breathe out, and bring your elbows closer to your body. One more time. Breathe in and bring your elbows closer to your body. Same here at the front. Breathe in, breathe out, and bring your elbows to the front one more time. Breathe out. And one last time. Breathe out. Okay, let's raise your arms like this. Now try to stand on the tip of your feet as much as possible. Breathe in and let go. Try to bring your shoulders back. Rotate your shoulders one more time. Bring your thumbs together. Try to reach as high as you can and let go. Now we're going to stretch our arms to the side. So your heel is to slightly come off the floor. 1, 2, 3, please. Try not to hit the person next to you. 1, 2, 3, 4, 5, 6, 7. Well done. You can high five the person next to you if you want. Right. You all have chairs here or at home, and you can use them. We are going to lift our right leg. We're going to work on our balance. So try to flex your bottom, and we're going to sort of move our ankle around. So try to look ahead. You may smile. It's allowed. Now in the other direction. Okay, you can relax. Now we're going to lift our leg and stretch it with the heel first and bring it back closer to your body. Of course, you can use your chair. So, okay, 1, 2, 3, 4, 5, 6, come on. 7, 8. Well, that's good for your balance, isn't it? 9 and 10. You can relax. Okay, now let's do the same with the other leg. So try to rotate your ankle in one way, then the other, please. Try to flex your tummy. And don't forget to breathe. Now, raise your knee. Now stretch your leg with your heel first. And try to hold it. 1, 2, 3, 4, 5. Everybody seems to be very focused. That's very good. 6. Try to breathe. 7, 8, 9, and 10. Great. Okay, now try to put your legs slightly apart on the same width as your shoulders, and we're going to squat. So try to push back with your bottom. Now down. Make sure your back remains straight. Okay, so we're going to do this 5 times. 1. Very good. 2. Don't forget to reach with your arms. Reach forward. 3. I'm actually losing the mic, said the speaker. 5. Well done. Well done. Congratulations, everybody. Now, one last exercise. Try to stand on the tip of your feet, and we're going to make it a bit harder. So stick to, so trying to stand on the tip of your feet and come back to your heels. So we're going to do this 5 times. 1, 2, 3, 4, 5. Okay, now just relax. Okay, you may sit down now. Now we're going to wrap up with we're going to end this active break. So we're going to do a bit of cardio now. Try to sort of tap with your feet on the floor, and we're going to speed it up a bit. Try to speed it up a bit more. Faster, faster. Okay, thank you very much, everybody. Thank you very much, Ingrid and Stéphanie. Thank you very much for this little workout. It's great. Now we're going to get down to the heart of our topic with Guillaume, the coordinator of the project, who's going to be telling us about it. Good morning, everybody. I'm delighted to be here with you. It's always difficult to talk to people just after a little workout. It's essential to be up to expectations. So let me quickly introduce myself. I'm Guillaume. I'm the team manager of the Moov&Smile project, and I'm really delighted to be here with you. So the objective for us to expand the boundaries of Siel Bleu over and beyond France. Now, let me tell you about my background. I've got a French father, a German mother. And to make things a bit tricky, I was born in Morocco. I grew up there for 15 years, and I now live in Spain. So, it was really right up my alley to work at European level. Now, what about our team for this project? We have Lucy, the EU project coordinator, Charlotte, who was the policy officer, the project officer, who's right at the back there. And let's hear it for Charlotte. Let's hear it for her. And Benjamin, who's in charge of the project communication, who's also at the back. So a huge thank you to the entire team. Okay, can you please move on to the next slide? So the origin of the project. You can see here my gran. So that was 44 years ago. So that gives you more or less an idea of how old I am today. So she spent the last 2 years of her life in a care home, on a retirement home, and she passed away after a fall, after she unfortunately entered the vicious circle, the spiral of the falls. So she had fracture, then it all got worse. She made more severe falls. She fractured a hip, then was admitted to hospital, and unfortunately never left it. And there are really two things that struck me at the time. The manager of the retirement home told us that unfortunately falls were something that occurred quite often. And he told us that on average, elderly people in retirement homes fall about twice a year, and that's the biggest killer. It's the first cause in terms of mortality. So I wondered how we could avoid something as simple as a fall. At the time, I was not familiar with Siel Bleu, and that's how I got to know the organization. And that's how we managed to show with a clinical study that was also financed by the European Commission that the risk of falls can be cut by 36% with only 1 hour of physical activity organized by Siel Bleu. So falls are the third cause of mortality in retirement homes. So with only 1 hour of physical activity, where you have a good time, just as we've had just now, where you can actually meet public health needs. So again, I was saying, I was really struck by this. And the other thing is that, as I discussed with the retirement home manager, when my gran started to experience a series of falls, well, the manager told me that he talked about a protocol for people who were at risk of falling, and he said that it was part of a specific protocol and that it was part of the range of services that they offered as an extra on top of the monthly fee that had to be paid. So it was a protocol to prevent falls, and I realized after that it was just the nurse who would swing by in the morning just to say hello and make sure that nothing had happened to my gran. So I wondered how, in such a small community with 40, 50 people, where everybody knows each other, where everybody spends time together, how can you end up in such a situation where the retirement home has to charge an extra service? It's only a good morning.
So that's the kind of dehumanization that we are fighting against. And that's why we want to promote our own approach in France and in other countries, in Germany, Spain, Portugal, Ireland, and Belgium. Now, a few words on the project itself. In a nutshell, it's a project aimed at supporting long-term care. According to long-term care's definition, it includes a wide array of types of care, medical, social, personal care, to improve the functional abilities of fragile people, to give them back some access to fundamental rights and dignity. Now, I was interested in the functional capacities or functional abilities in that definition. What are they? There are indicators for that, including a grid from 0 to 100 to measure the ability to perform daily tasks like washing, eating on your own, moving on your own. So all of that is reviewed, assessed, and we tend to take a look at that grid without taking into account the dignity that lies behind it. Let me give you one simple example. In our sessions that we organize everywhere in Europe, we organize fine metricity sessions. They are simple exercises aimed at improving your hands abilities. Your hand metricity. And that helps you improve your ability to grip something, to hold something in your hand, like a simple spoon to eat. And that also then improves your daily life and therefore your dignity. So functional abilities and dignity are very much related. So that's the perspective that we took, the approach that we took in our project. And that's how we took part in the call for tender of the European Commission. The goal is to use physical activity as a prevention tool and see how it contributes to long-term care at the European level. Second goal was also to use new paths to create partnerships and promote equality of access to physical ability programs, especially for the most fragile people. And one last point, our final goal was to ensure the sustainability of the project. So one of the key elements of the project was to ensure that it was long-lasting beyond European funding, beyond the 3 initial years. How can we ensure through dissemination, through communication, through this white paper, through the toolbox, how can we ensure that anybody can take over that project and then also bring their own contribution to keep building that project further based on our learnings during the first 3 years. How did it work concretely? 4 steps. You see them summarized on the screen. Of course, this took 3 years' time. It was a huge experience. First of all, we had to recruit people, build a team. So we built a project management team with 3 people and also a field team, or field teams in Germany, in Portugal, and in Romania. To improve the feasibility study and the undertake a market study. Now, one of the key learnings from that was the diversity of the situations. We'll elaborate on that later on. One country isn't the same as the other, and even one region isn't the same as the other. And our studies enable us to understand that in practice. And the third stage is the most interesting one. That's the pilot project. That's when you build your first experiment. You start walking the walk. You go from theory to practice. And the idea here was to finally understand if our projects met the needs of the people that we identified. And the last building block was the white paper at the end. This is, like I said before, with the objective of making the project sustainable beyond European funding. A few key figures. We implemented 5 experiments. They weren't the easiest. They are all complementary, so we never simply copied the same experiment. We wanted to try out 5 different approaches. We recruited 8 people. They're here today, most of them. We supported 1,000 people. They are still being supported today, because like we said, we want to make that approach sustainable. So I'll talk about the economic model and funding later. We provided over 600 hours of adapted physical activity, and we created 2 legal entities, one in Germany and one in Portugal, to host all of our activities and enable them to be rolled out further in the future. And just on this next slide, yes, thank you. You see here a summary of the projects that we undertook in the 5 countries. First of all, the falls prevention program. And all of these projects were assessed, reviewed. We measured the advantages of these physical activity projects. So for falls prevention, we undertook some tests to assess the improvements. And all of these programs were conclusive. The indicators showed they led to improved results and also to an improved quality of life. Not only improved health, but improved quality of life, improved mental health as well. In Spain, we implemented a post-COVID syndrome program to support these patients. In Europe, 36 million people suffer from long-term COVID. And in the 3 last years, only 3% of them managed to get rid of any kind of syndrome. So it is of utmost importance to help the most fragile, the most vulnerable people with these post-COVID syndrome to improve their access to care and improve their well-being. Falls prevention program also in Portugal, a Parkinson's program in Ireland. We'll hear more about that later on. And in Germany, we also implemented another falls prevention program that was in a different environment. It targeted communities in Belgium or also retirement homes in Portugal and in Germany. So that's it for the main projects. We'll elaborate on these projects a bit later, but we're not going to enter into the details of every single project. We're just going to show you an example of the main ingredients of these projects. So we'll start with the project leaders who are with us. Svenia joined Siel Bleu very recently, and she can tell you more about that. And we'll also showcase what our programs do through the experience of physical activity. And for that, we need data. We need to demonstrate its effectiveness, and we need science. That's why we had a scientific approach with Vanesa Vicens from Barcelona. She brought a very important contribution in that regard. And we also want to give the floor to our participants who took part in the project. Thank you very much. You'll have testimonies from them. Thank you very much, Guillaume. Svenia, I'll now give you the floor. So you can tell us more about your Siel Bleu project in Germany.
This topic is so important for Germany, but not only for Germany, it's important for every other country on this planet. And the aim of prevention is to to keep people healthy. And it's very important to focus on that more than on rehabilitation, keeping people healthy and avoid the development of diseases. So that's what we are focusing on. And also in Germany, I think it is very important. If we look into Germany a little bit, we have a law, and it is called the Prevention Protection Law, and it was enacted in 2015. And the aim of this law is to implement health promoting programs in living environments. So where people live, where they work, and where they spend their free time. That's what they did for the last 8 years now. And there was a lot of activity, a lot of progress, and a lot of research in this field. And I think the conclusion, it was a publication, was published just last year. They concluded that there still is a big need to do something for prevention, and we don't have the perfect program now. And there's a big problem with having sustainable programs. So, and also to reach minorities. That's why I think the Moov&Smile project was a first step in the right direction. And that's why it is so important to talk about this today. So, but why is it important for Germany to do a project like this and to work on preventive programs, especially in the long-term care sector? And within the Moov&Smile project, I worked with a lot of participants doing a 4-month trial, mostly in nursing homes. We had some daycares, but it was mostly nursing homes. And I want to tell you one story to point out the importance of preventive programs, especially with adapted physical activity. And it was a nursing home resident. So it's a story about the participant of a group in a nursing home. I went to that nursing home every Thursday in the afternoon. And at the end of the 4-month program, the staff of the nursing home, they told me that one participant, let's call her Margaret or Marianne, she refused to have her coffee at tea time because she was too afraid that if she does drink coffee or eat cake, she would miss the session, the APA session. So I think that story tells us how important it is to do sessions in nursing home and to do a lot for prevention in this sector. And this is only one story about this, but there are a lot of stories that are pointing out the importance of physical activity in the sector of long-term care. And I think if we look to current German publications, they all point out, especially in the sector of physical activity, that we have to find programs that are sustainable. And very important, they pointed out that it is crucial to have programs implemented by professionals that are highly qualified and also very empathic. That they found that this is a very, very important aspect. And I think the Moov&Smile project is also the right step, and we are on the right track, I think. So we are in front of a big challenge now. We have 13 facilities, and of course, we want to go on, but we still are struggling with the funding opportunities. So there's a lot we have to work out, but it's so important to be sustainable and to keep working with them. So what am I proud of? I think the most precious thing is that I went to that sessions, and all the participants, and I can say all, seemed to enjoy the program and really profited from it. So that's a big thing. And also the staff, most of them told me that it was very important for them to continue doing APA sessions. Even they have staff to do activity in the nursing homes, but they saw the value of the APA sessions and they really wanted them to go on. So that's what we wanted it to be. And I'm really proud that we were able to reach that goal. So I only have left to say that I want to share with you a small video of my daily work within the test phase of the Moov&Smile project. So you have a little bit of a visual how it was. And yeah, enjoy and thank you.
Hallo, ich bin Svenia und wir sind jetzt bei unserem ersten Stopp angekommen. Das ist ein Altenheim. Hier führe ich angepasste körperliche Aktivität durch mit einer Gruppe im Sitzkreis. Kommt mit! So halten, als ob wir ihn fallen lassen würden. Fest und weit. Und jetzt quetschen wir den Ball zusammen. Fest. Quetschen, quetschen, quetschen. Den haben wir noch. Ja. Wir haben jetzt 2 Stunden hinter uns gebracht. Das heißt, wir haben eine Demenzgruppe und eine Gruppe mit Sitzgymnastik. Und jetzt würde ich alles wieder zusammenpacken. Dann geht es ab aufs Fahrrad und zur nächsten Einheit. So, genau. Ich fahre mit meinem Fahrrad und weiß, dass das das Einfachste mit dem Fahrrad zu fahren. Es gibt viele Radwege und man ist einfach viel schneller unterwegs als mit dem Auto. Okay, los geht's. Jetzt sind wir hier in einem Café. Ich mache eine kleine Mittagspause und dann geht's weiter zur nächsten Schule. Super! Klasse! Und hoch die Arme, Eva! Gut! Wir gehen rüber. Und lass die Arme! Vielen Dank, dass ihr heute mit dabei wart und mich bei meinem Tag begleitet habt. Ich setze mich jetzt noch mal eine Runde an den Computer. Vielen Dank fürs Zugucken. Tschüss.
Thank you very much. Merci beaucoup, Svenia.
Thank you very much, Svenia. Vielen Dank. So that's the first ingredient to organize a project. You need to have splendid project leaders. So thanks very much for sharing a bit of your everyday life with us. Another very important ingredient is that you can't achieve anything on your own. And at Siel Bleu, we have a lot of partners. So we have Vanesa, who is a pulmonologist in Barcelona, and she's going to be telling us about her Moov&Smile and about her contribution. Thank you very much for being here. And also thank you to our remote participants. Thank you for inviting me, for organizing this event, and also thank you to the European Commission for financing this project with COVID patients.
Si on peut, ouais, d'accord. Alors, tout a commencé après le Covid.
So it all started after COVID. We had patients who were really struggling. So Guillaume got in touch with a hospital to see whether there was anything we could do together. And that's how this adapted physical exercise project saw the light of day. It was first reviewed by an ethics committee and then started. Now, as you know, many patients who were admitted to hospital with a moderate to severe COVID infection are patients who have then suffered from persistent dyspnea. And it's been going on for several years for many of them, and it really deteriorates their quality of life.
Comme je disais, le projet, on peut passer plus vite là, hein, parce que
yes, we can speed up the PowerPoint. So we did this study at the Bringuier hospital with some of our patients. So it was a pre-post experiment. That is, we did some tests before.
Répète l'épreuve. Alors, on a,
so we would do tests a first time and then a second time. So we recruited 96 patients, but eventually only 68 took part. Now, let me tell you about the objectives of the study. The objective was to assess how supervised physical exercise influences patients with a persistent dyspnea as regards their exercise capacity. So how how much can they travel, what distance can they cover, dyspnea, also the respiratory function and quality of life, with tests on the quality of life in relation to anxiety and depression. So before taking part, people had to sign an informed consent form. Then it was a randomized trial.
Et avant de commencer, tous les patients faisaient des épreuves.
So before we started, all patients took the tests with the walking tests, the quality of life tests, amongst others. We had 3 groups. We had the supervised physical exercise group. They were supervised by the Siel Bleu team. Then 12 sessions for 12 weeks, 1 session per week. We also had a control group, which at that time did not take any physical exercise. And then another control group. It remained a control group throughout, no physical exercise over the 6-month period. And then those who took physical exercise in the first period became the control group in the second period. And the other group, the control group, started to take physical exercise supervised by Siel Bleu in the second period. At the end of the program, we repeated the tests to see whether there had been any changes. Okay, on to the next slide. Now, the results. We have demographic data here. You can see that groups were more or less similar, except for the control group where we had half the number. The average age was between 63 and 65, and there were more women in the 3 groups. As regards the results for the walking test, it's the next slide. These are the most important findings. So I'm going to spend more time on this. So, how much distance could the control group cover? So the control group, same for the group that was the control group in the first period and the intervention group in the second, and also the results for the intervention group, and which then became the control group. So you can see how the intervention group, so the group that was intervention in the first period, at the end of the 12 sessions of the 12 weeks, you can see that the travel capacity increased by 30 meters. So to us, it was statistically significant, clinically significant. Less than 30 meters is not significant. So when people take physical activity with supervisors, they increase their capacity by 30 meters, whereas the control group in red lost in capacity. And the control group that was highly motivated, they were waiting for supervised physical activity. So they did activity. They went to the swimming pool. Nearly all of them walked every day. Some of them cycled. So they increased their capacity by 8 meters on their own. But clinically, it's not significant. But then, when they did supervised physical activity in the second period, you can see that they increased their capacity by 34 meters. So when both groups were supervised by the Siel Bleu team, their capacity significantly increased. And this is important because we can take physical exercise on our own, but you may not reach the target, whereas with supervised exercise, you do reach the target. That's the most important takeaway here from your work. Okay, on to the next slide. Now, as regards dyspnea, we use the MMRC scale. So we have different colors here. Well, it's all blue, so light blue. Actually, it should be lighter, but that means that there's no dyspnea. Then, for example, number 1 is dyspnea when you go upstairs or when you walk. Slightly darker blue is when you walk on level ground. Then 3, dyspnea is with minimal exertion. And then 4, which is the darkest blue, is dyspnea at rest. So you can see that at the beginning, the shades of blue are more or less the same, 20%, 50%. But when you do the intervention, you can see that at the end, the share of light blue increases. That is, people who worked with the Siel Bleu team have experienced less breathlessness of dyspnea after the intervention. And as regards depression, that's the next slide. We're going to have a look at it. It's also different shades of blue. So lighter means less depression, darker means more depression. So this is an animated slide. So here, so we have the control group. We have the control intervention and the intervention control group. So the blue arrow at the beginning, you can see that all three groups have the same level of depression, more or less. So the intervention has not started yet. And we were a bit shocked by the results. At the end of the first period, the group that started with the intervention had its darker shades increased. That means they were more depressed after the intervention. And this level of dark blue persisted after the second period. Whereas the group that was controlled at the start, the yellow one, this group managed to reduce its depression levels, especially after the end of the intervention, which is the second period. So we were a bit upset by these results. We believe that, well, this group had the intervention between April and June, and that group between July and October. So in Spain, in the summer, people go out more, they sit outside in terraces, they connect more with people. So maybe it's an effect of from the exercise, but also from their social life. Whereas the other group may not have enjoyed the same periods. Maybe it's because of that, we're not sure. This is our last slide. So what are our conclusions? Well, supervised physical exercise improves the distance covered in the 6-minute walk test, dyspnea, and quality of life. All patients were delighted with the intervention. They were really happy to take part. And well, the results in terms of depression are those that really came as a shock to us. The group that did the supervised physical exercise in the first period seems to have been more depressed than the second period group. This was our conclusion in Spain. And this is the last slide to acknowledge all the patients who took part. We really were able to conduct this test thanks to them. Also, thank you very much to the Barcelona Siel Bleu team for getting in touch. Thank you to all the nurses who did the tests with the patients. Thanks to the rehabilitation teams, the pulmonology teams, and to the statistics team. Thank you very much indeed. Thank you very much, Vanessa.
Merci beaucoup, Vanessa.
Thanks very much.
On avait dit 3 ingrédients.
So we said 3 ingredients. We talked about project leaders, we talked about partners, and of course participants, because everything we do it for them at the end of the day. So we wanted to ask them, for their opinion. And then I'll let you take the floor, Thomas, to talk about the project in Ireland. I think it's particularly important to be encouraged to develop intellectually and physically, to make sure we don't stay drowsing in our rooms. So the program that's been offered is perfectly adapted to me. I really like to do gym. And I would do this every day if I could, because it's good for me. Because when I do this, when I take exercise, I forget about my problems. When I'm active with my legs and arms and the rest of my body. Because thanks to all this, my head, my mind works out as well. So I like gym. Well, we're active, we do things together with balls, etc. And we're kind of a little family.
enjoyable.
Yes.
But they've been delivered extremely well, with sometimes bigger classes than others. But people are just pleased with it and happy with it. And if people do the exercises and they're encouraged, I think it makes life a lot easier for them.
J'ai de l'arthrose un peu partout, évidemment. Voilà, j'ai beaucoup travaillé dans la vie.
I've got arthritis in several parts of my body because I worked a lot. And the Gym Sana, the Siel Bleu entity facility in Belgium, if I didn't have them, you know, in a week, it would be terrible because the contact with people and the instructor is great. It is really amazing. If you want to work out, if you want to do some gym, sign up with Gym Sana.
Merci Thomas.
Thank you, Thomas.
Thank you, and good morning. It's amazing to be here to speak to you all today, and it's incredible to see the video. It's a real example of the success of Siel Bleu, is the success of our participants. Like in Ireland, we know Tony, but it's really inspiring to see the people in other countries participating in our programs, and you know, it's really incredible to think that, you know, we have nearly deliver programs to almost 250,000 people throughout Europe, which is an astounding figure and really incredible. My name is Thomas McCabe. I am the national manager with Siel Bleu Ireland. I've been working with Siel Bleu now for almost 11.5 years, and it's been amazing to be working on this project. Just to give you a little bit of background on the organization, previous to this project, the first patient advocacy project that we worked with, we started 10 years ago for people living with COPD in Ireland. It was the first project we delivered for a chronic disease group, and what that did, so what we did with that was we developed a framework to develop programs for chronic disease groups. So what we did, we went away and we spoke with experts. We spoke with expert physiotherapists, experts in the health service in Ireland, and then developed a program, developed a pilot, and replicated it from there. So for people living with COPD in Ireland, there's almost 450,000 people. And that program has been a great success. We initially started that pilot with one program, and now it's been delivered with 25 COPD groups around Ireland. In 2019, we sought to measure the effect of that program with a social return on investment study. What we found was, for every €1 invested in that exercise COPD program, it saved the Irish healthcare system €22. So that has been the framework and the platform that we've used to deliver the program for people living with Parkinson's. So today in Ireland, it's estimated that there's over 15,000 people living with Parkinson's. In Ireland, our population is disproportionately low, and our population over 65 is going to go from 11% of the population to 22% of the population in the next 20 years. So there is an economic time bomb coming in Ireland. Across Europe, it's estimated that there's over 1.2 million people living with Parkinson's today. So in terms of the Parkinson's program, next slide, please. We called it the Big Program. I was designed to address problems for people living with Parkinson's. So we sought the advice of Paul Diamond in the Royal Hospital of Donnybrook to help us to redesign and implement a program for people living with Parkinson's, and then we started delivering with the Parkinson's Association of Ireland within the Dublin area. The program has been managed by Margaret, who's down the back there, and has been delivered over a number of months. Next slide, please. So in terms of its implementation, the program was selected in March 2022, and all the research and preparation was undertaken at that time. So we spoke with experts in the field as regards delivery of programs for people living with Parkinson's. So we would have reached out to Dr. Paul Diamond we would have consulted with the Davis Finney Foundation in the United States of America, and then consulted with the Parkinson's Association of Ireland in Dublin. And then in September 22, started implementing the program. There were four groups selected in the Dublin area, so within a good geographical spread. So Hunstown and West Dublin, Harold's Cross, Portmarnock and Loughlinstown. And we had 3 rounds of testing. So the testing was undertaken to measure physical metrics and quality of life as well. Next slide, please. So in terms of the results, we've seen a significant improvement in participants' sit to stand. The hand grip strength showed a significant improvement, as we've seen with as well with timed up and go. Perceived quality of life remains stable throughout the program as well. Next slide. One thing we did find, interestingly enough, though, throughout the project, we've seen an increased participation in the project. So every testing round, we've seen a increase, and anecdotally, we've seen that the engagement from people participating in the program improved as they went on. There was a little bit of resistance at the start as we implemented this program and the principles of the program, but as they went on and they seen the results of the test, they see the participation improved. Slide. Most importantly of all, the outcomes and the results. What this has done, it has improved and strengthened our relationship with the Parkinson's Association of Ireland. They've expanded this program to other Parkinson's groups throughout Dublin, and we're in discussions with to hopefully expand this program nationally. The programs are continuing on now, with the Parkinson's Association paying for it themselves, which is success and what you want to achieve. And this program is available now to be replicated in other countries that Siel Bleu Ireland, Siel Bleu operating as part of our global expansion plans. Just to finish off, as you mentioned, there's a lot of people to thank. Firstly, we have to thank Margaret, who has led the program expertly for us over the last number of years. We have to thank Paul Diamond and Mary Butler within the Parkinson's Association, who have been incredible. I remember a number of years ago sitting in La Maison de Vie and listening to Jean-Michel, and he spoke about, one of the frustrations of work with Siel Bleu is that there's so much we can do and we're not able to do. But this program has allowed us to develop a program for people living with Parkinson's. It's allowed us to bring it to a level, to get some data, to expand it nationally, and now we have the confidence that hopefully now we can expand it internationally. So thank you to the team in Moov&Smile as well to having us part of the program. It's been incredible. It's been incredible to work with you as a team as well, and hopefully we'll be able to do that for many years to come. Thank you very much.
Merci beaucoup, Thomas. Bah oui, c'est juste le début.
Thank you very much, Thomas. And yes, you're right. It's only the start. Guillaume, perhaps I'll give you the floor to conclude these beautiful projects.
Des beaux projets en réalité.
Yes, beautiful projects indeed.
On parle d'accompagnement.
As we heard, we are talking here about support for vulnerable people, health benefits, physical benefits, quality of life. All of that was actually measured.
Comme je le disais tout à l'heure, que l'activité physique et que ses bénéfices.
And we also showcased that physical activity is of the essence, and its advantages shouldn't be underestimated. We talked about 260,000 participants, which is completely mind-boggling, but there's so much to do left. And
comme Thomas aussi a pu le montrer tout à l'heure,
as Thomas just said before, one of the fundamental points of the project, and that makes me very optimistic for the years to come, is the partnerships that we have. the partnerships that we build in the field,
cet écosystème, en fait, avec, ça peut être des associations de
the
quartier,
ecosystem that we now have with neighborhoods and non-profits, local councils,
des maisons de retraite, tous ces
retirement
partenariats
homes, all of these partnerships
toutes ces petites graines qui ont été
that
semées
mean today that we planted many seeds thanks to the European Commission, the funding, and also thanks to the impetus of the entire team. But now all of these seeds are going to grow.
Voilà, le résultat du projet, en plus des bénéfices
So we know that
santé,
there is a
c'est
future.
aussi, en fait, ces partenariats
So
locaux.
the result beyond health benefits is also these partnerships, these local partnerships that we have created, and we now have strong links with committed partners locally who support our actions.
Ensuite, l'un des points en fait aussi qui est très marquant en fait sur le projet,
Another
c'est
factor which is striking within this project is that when you're guided by that motivation to be close to your participants, to support them properly, when you know what the advantages are,
cette énergie en fait à déployer.
is that you have a lot of energy to roll out, and you're trying to deliver. You try to be by your participants' side, and it's not easy to coordinate 5 projects in 5 different countries with all that it entails.
Il y a eu en fait aussi je pense en fait un succès du projet dans sa
But
capacité.
I believe that the project was successful in its ability to implement operationally these projects in different countries with the participants in mind, always for their benefit.
Bien sûr,
And of course,
met en avant et ce qu'on a constaté en fait sur le projet.
what we also noted as part of that project is the need to work hand in hand, the need to work together. I talked about the partnerships, but it also goes for all the people involved in the project directly and indirectly.
Un peu sous l'eau en fait aussi pendant
We know
cette
that during
phase-là.
COVID times, for instance, health practitioners were underwater.
Où en fait, justement,
And we were part of a cross-disciplinary approach. People from physical activity working hand in hand with health practitioners, with physios, all of that meant that we could become more resilient in the face of health crises because of that multidisciplinary approach.
Alors sur le projet, en fait aussi, l'un des grands enseignements, c'est en fait aussi cette nécessité de travailler sur le long
What we
terme.
also take away from this project is the need to work with the long term in mind, the need for financial visibility, the need for sustainability.
Dur de comprendre les mécanismes de
Objectively,
financement.
it's very complicated to understand the funding mechanisms, how diverse they are, the varieties from one region to another, from one country to another. It's a matrix that's very complicated to make sense of. And this is something that we can keep working on, because we managed to improve that visibility. We managed to find some kind of continuity in terms of financial commitments. Next slide.
See you next.
If there's a next one.
Alors, ok. Sur les difficultés qu'on a pu rencontrer.
Well, these are actually the obstacles on screen. Okay, well, of course, there were many.
Le premier, en fait, c'est toute la partie administrative,
Let's say that
juridique et légale.
the main obstacle was the admin, the red tape, the legal stumbling blocks. We know that there's still work to do in terms of standardization, recognition from one country to another.
Nous, en fait, aussi, pour être aussi très
And another obstacle was also the difficulty of building a team. we understood by making progress that we had to have a proper structure, a real team, a real legal entity as well to support us internally and externally.
Ça peut prendre 6 mois, par exemple, pour ouvrir un compte bancaire en Allemagne.
I didn't know that it could take up to 6 months, for instance, to open a bank account in Germany. I don't know why, but that was complicated, and that prevented us from starting our activity earlier. And we are mainly practitioners in the field. We want to be together by the side of our participants. So that was quite frustrating. We sometimes struggle to understand why administration was as slow as it was.
Les difficultés liées en tant que liées au
Another obstacle was the difficulties of being a newcomer. When you're new in a country, it's not easy when you just arrived. Because in some cases, you might already have some recognition, which is the case in France, for instance.
Ça nous est arrivé, enfin ça m'est arrivé moi personnellement en fait d'avoir comme réponse c'est super ce que vous faites en France, mais
some people told me literally, well, what you're doing in France is great, but what do you actually do here? So even though you've already done things elsewhere, when you come to a different place, you need to start from scratch sometimes. You need to showcase the value of your program locally. So one thing that was very important, very interesting in that regard was the ability to conduct a pilot program, a pilot experience, a pilot experiment. And that meant that freely we could demonstrate the benefits of our program without any financial obstacle for our counterparts or the people in front of us, so that they could experience it in real life and understand the advantages and get the feedback from participants for it then to be sustainably implemented. Like I said, there's also lack of visibility in funding mechanisms. I said before that it's a very complicated matrix. Everything differs from one region to another, from one country to another, even from one town to another, from one local town council to another town council, that you can have different rules. So that makes it very complicated to have a strategy, a vision, because of that diversity of situations in the ground.
Sur cet aspect-là, qui est lié, c'est que en fait, on a
that's related to that
peu de visibilité ou en tout cas très
is
peu
also the lack of
d'engagement dans le long terme.
long-term commitment.
De l'activité physique qu'on apporte
We know
avérés
the physical activity advantages in terms of spendings, quality of life, health. But at the end of the day, who pays for all of that? We consider that it's a collective responsibility. So we consider that more players should be involved with a long-term vision, but that's not necessarily obvious and established everywhere with the partnerships that we have, or with the people with whom we've worked in the past 3 years. Next slide, please.
Alors, ouais, les bonnes pratiques ou les.
So moving on to some best practices.
Quelque chose de
some key practices at least.
Qui est crucial, c'est être très
something that might be quite obvious, but that is essential.
Sur ses valeurs et ses missions. C'est ce qui permet en
we
fait
need to be crystal clear when it comes to our values and our mission.
D'engager en fait nos acteurs,
we need to define that very clearly. That's what is going to bring on board our partners.
C'est ce qui fait que finalement au niveau
that common foundation that
était assez engagé sur nos programmes. Donc voilà, la santé pour tous.
That's what's going to bring us together and hold us together.
Et l'activité physique, qu'elle soit accessible en fait au plus grand nombre.
In this case, accessibility of physical activity for everyone, improving their health through it.
En fait, que des partenaires puissent monter en fait à bord du navire.
So thanks to to these values, to that clear mission, we can bring partners on board and make those partnerships sustainable. Then I already mentioned the plurality of the situations, the diversity of the situations that we encounter. This is an understatement. situations are incredibly diverse. Physical activity as well. The importance of it differs depending on the region you're in. Some staff are convinced by its importance in some countries and not so much in other places. Some teams might say in some countries that, well, they already implement physical activity, they already do that, but actually when you look into the details of what they do, they actually have just 40 people in one room doing the same thing, but with different levels, different abilities. So they already have some kind of physical activity in place, but in an unstructured way with big diversity within the group. So that's what we can then try and take into account to improve it. Another key factor, another good practice is to be very much present in the field. It's important to interact, to get feedback continuously. That is what the 100 officers in charge of the region in France do. That's what the dozens of people in charge of the region in Spain do as well. The project leaders in Germany and Ireland. Their contact with the field is crucial. Because, like I said before, there isn't a one-size-fits-all approach. So we need to be able to react. We need to be very proactive and to react rapidly, depending on the situation that you identify in front of you. And the only way to do that is to be present in the field. That's the only way in which we will be able to adapt and implement the projects that we've been talking about. And I think that's it. So thank you very much once again to all of you.
Merci beaucoup.
Thank you very much. Now this brings our first part to a close, the first part dedicated to the Moov&Smile project. And we're now going to open up to the second part of our conference dedicated to guest testimonies. But first of all, let's move a bit, because that's also why we are here. So Manuel, please join me. Manuel. You're going to help me make everybody move whilst sitting on a chair, because that's one way in which you can remain active when your legs don't react as well as they used to. So we thought it was important to showcase that.
Hola. We are going to do an active break, okay, with exercise that we do in our chair gym program. This program is adapted for people with disability, and it's very important for them to do as exercise as they can do, just for improve their quality of life. For example, trying to keep their capacity of eating or cleaning by themselves. So, and we want to show you that it's easy to train or to exercise all the body from a chair. I hope you enjoy it. Okay. So let's start with our shoulders. Lift your elbows and draw circles backwards. Okay. Not at square circles, please. Okay, forward. Très bien. Now, cross your arms and open it. Take care of the people beside you. Cross your arms and pull it back. Another time, cross your arms and pull it back. Okay, now reach forward, pull it back. Reach forward and pull it back. Reach forward. It's important to feel the connection between this movement and the muscles of your back. Okay, very good. Reach forward and pull it back. Now bring your hands, okay, and rotate to the right. Keep for 3 seconds. Now rotate to the other right. Okay, 3 seconds. Again to the right. And to the left. Okay. Now, with your right hand, please, we are going to go to the floor. Okay. And go back. If the floor is very far from you, you can touch your leg. Don't worry. Go to the floor. Okay. The right hand and left hand. Go back. And the left hand. Okay. Now, we are going for a walk in this beautiful forest. Yes. Going up your knees. Not very fast, please. And now, the right knee up and do forward cycles with your knee, with your leg. Okay. Very good. Now backward circles. Okay. Change your knee, the left one. Okay. Forward and backward. Very good. And now continue with a walk. Okay. Now just up your heels, down, up your heels, down, up your heels, down, and then your tools, up your tools, down, up your tools, down, up your tools, down, and continue with the walking. Okay, and on the count of 5, we are going to run, okay? Just 1, 2, 3, 4, 5. Just run. Okay. And take a deep breath. Cross your arms. And the last one, take a big breath. And finish. Merci beaucoup.
Merci beaucoup, Manuel. Et donc, on va entamer cette deuxième
Thank you
partie.
very much, Manuel. Now let's start the second part with Pierre Jésus, professor in charge of nutrition for the University of Limoges. Thank you very much for being here with us. It's important to see each other in real life. Thank you.
Merci beaucoup. Je me fais m'essouffler avant de faire la présentation.
Thank you very much. I got out of steam, out of breath before this presentation. So I represent the chair of the collective for the fight against denutrition, and Siel Bleu is a partner to this organization. So let me tell you about denutrition. That's what we fight in our collective. Malnutrition, actually. So let me give you a picture of the situation in France. Let's look at the worrying side of things. Let's talk about death. You can see here the 2 biggest killers in France, cancers first, and then cardiovascular diseases. They are kind of neck and neck. In Europe, it's more or less the same. And there are 2 conditions related to nutrition. Cancers lead to malnutrition, and I'll share some figures with you just afterwards. As you'll see, cancer is not very good. Malnutrition is not very good. We also have overweightness. So before diseases occur, you need to do prevention. And also in relation to cancers, I've shown here the three main causes: smoking, which usually leads to cancer, drinking, alcohol use as well. It does use energy, but it's not the best source of nutrients. And you can see that in third and fourth position, the diet and obesity and overweight. Now, if you take these two together, you move on to the second rank. Now, on to the next slide. Now, a few figures about France, about malnutrition. I'll explain this in just a minute. We have 2 to 3 million of people who are undernourished or malnourished, about 5% who are non-elderly people at home, 5 to 10% who are elderly people who live in their homes, then 20 to 40% elderly people in care homes, 50%, that's bigger, people in hospitals. So in France, an elderly person is defined as someone over 70. And we have 40% of people who with cancer. So you can see cancer is back again here. And that's just a fraction. And also, one child out of 10 who's been hospitalized is malnourished or undernourished. So you can see that this is a very frequent condition, especially in institutions and in hospitals. Now here's a chart from a study that was carried out in England with a large cohort. You can see the BMI at the bottom, the body mass index. I suppose you're familiar with it. It defines our build. So for regular adults, it's between 18.5 and 12. Now, this is basically the risk of dying. This is the normal area. That's where you are less likely to die. It's something that was identified a long time ago. Now, when you are overweight or obese, there's a rise in the risk of dying, mainly due to cardiovascular diseases and cancer as well. And you can see it's the same here with the malnutrition and undernourishment. You don't need to go that much on the left. But with age, obesity is less of a problem. I'd rather have an elderly person be here on the right than here, there on the left. I'm not going to ask an elderly person to slim down, but we need to ask the elderly to be active. We don't want to ask them to lose fat because they're going to lose muscle. So, you know, it's all related. So when I teach nutrition to students, it's not only about dietary aspects, it's also related to physical activity.
Là où c'est encore moins problématique, finalement, l'obésité, c'est avec certaines pathologies. Vous voyez, les pathologies neurologiques.
You can see here neurological conditions, dementia. So someone who has dementia and who's obese has a lower chance of dying than someone who is malnourished. And that's the reality with a lot of chronic diseases. So what is malnutrition? It's a condition. It's a disease. It's not normal. Now you might say, right, but people with cancer, they lose weight. No. So it's an imbalance. You know, my work is always about balances and imbalances. So it's an imbalance between the metabolic needs of the body and, on the other side, intakes in energy, proteins, or micronutrients. So basically, you have a reduction of intakes. Basically, someone who loses weight because they eat less, and also a reduction in or an increase in metabolic needs, or you can have both at the same time, the reduction of intakes. Now, it's all characterized by a loss of what we call the lean mass. So if people don't eat enough, and if they have a condition that uses energy, well, you know, your body is well organized, so it's going to make sugar with or out of muscle, but it's not a good trade-in. And also, there's a loss of fat mass. So a lot of terms that you might be familiar with here: fragility, the loss of muscle mass.
Ça génère de la perte la perte musculaire.
And also other aspects that lead to a loss of proteins. So it's cachexia, for example. Someone may also be obese with cancer, but may actually have lost a lot of weight. And malnutrition is at the center, at the intersection of all this. On to the next slide. Now, I've just kept a very simple list to make it simple. So when you do the APA sessions, you can talk to people and they can tell you, for example, well, since I've arrived here, I've lost 5-10 kilos. You know, weight loss always happens for a reason. So it can be a loss of appetite. Also, for example, when people have difficulties to swallow, a reduction in their swallowing capacity due to cancer, throat cancer. Also, we mentioned something else earlier on. We said that it's unethical and undignified to restrict the sugar and fat intakes of elderly people in nursing homes. It only happens when doctors deliver prescriptions to this end, but it's pointless. And actually, it makes people die faster. Constipation, disabilities, of course, you've seen that even with disabilities, people can take exercise, pains, chronic pains, also cognitive disorders, for example, related to memory, respiratory failure. People would rather breathe and eat, and vomiting. So it was a non-exhaustive list. At any rate, it has consequences. Malnutrition has consequences, and it affects everything. It doesn't improve anything. The psychological state, you don't feel as well. It also alters the respiratory system. For example, BPCO or COVID, or actually COPD or COVID. Also, it affects muscles. You lose fat, energy reserves, but you also lose muscles. The body does that, uses muscle to reproduce proteins elsewhere. The digestive tract, the healing process, and autonomy. It affects all of these dimensions.
Et voilà, donc ça entraîne des complications.
There you go. It leads to complications. It reduces chances. It increases mortality. It alters the quality of life. Clearly, it leads to a loss of autonomy. It's very difficult for people to return home. So there are people who would be referred or to a retirement home or nursing home, but who actually manage to come home if you work on their nutrition. There are people who, and many people stay longer in hospitals, so at the end of the day, it costs more. So malnutrition is like obesity, it costs more. And here's the link with what we said earlier on. Malnutrition leads to muscle loss, fat loss, bone loss. Muscle loss leads to a loss of autonomy, of strength, of balance. You're going to trip up in the carpet because it's more difficult to get around. And it leads to, well, if you have, it increases the number of falls and it leads to fractures. Also bones. So here it raises the risk of fractures. Now, don't worry. Surgeons will always give you a hip replacement or will insert nails in your body. But unfortunately, patients will not be able to evolve after that. So it's a vicious circle. Onto the slide. I also had included loss of autonomy. So it affects people's autonomy. So eventually people will become more and more fragile or frail. Right, now I've not got into detail here, but the objective to fight malnutrition is to tackle the root cause. The first thing is to recognize that people are ill, irrespective of the illness. It can be depression, cancer, respiratory issue, anything else. So people who suffer from these conditions have a risk of eating less and of losing weight. So for example, if someone has lost 5 or 10 kilos, that means that something is going on. So you need to feed people. So you can try and have them eat more, but it's not easy for someone who doesn't want to eat. So either you give them richer food with more energy. So, I'm fine with fat and sugar. It's, we're no longer looking to prevent obesity. It's now, that stage in life. It's no longer the objective, and you can't prevent cancer when they already have cancer. It's the same as for, respiratory failure. When people experience respiratory failure, you give them oxygen, etc. So if people do not have enough, do not eat enough, you use artificial food. And APA is very important in all this. If someone, for example, eats normally but has fractured a limb, for example, well, if they get a cast, when the cast is removed, the limb has lost muscle relative to the other side of the body. So it's very important to promote APA. You need to establish an information program. It has to be financed by the French or by the NHS. It's essential to do this to ensure a more effective prevention. And the last slide, I think. Now, we're looking here at the therapeutical change of the way of life. It's what we used to call hygiene and dietetic rules. It is essential in relation to obesity. As we've seen, obesity leads to cancers and cardiovascular disease, and both can actually lead to malnutrition. For example, if you have a stroke, you have then swallowing problems and you can lose weight. So in France, and it's quite worrying, since 1997, the prevalence of obesity has doubled. We're not yet on a par with America, but it's quite bad already, 70% of the population, and even more worrying amongst children. So this was in 2020. You can see that 17% of children from 2 to 4, 19% of 5 to 7-year-olds, and that's where you need to do prevention, not later. So these children who are overweight, 70% of them will remain overweight when they are adults. And you can see here in this table that people become overweight at an increasingly early rate. So that's my parents' generation. You can see here that 10% of the population was obese at 45. On average, that's my generation, on average at 28. And it's even worse now. So prevention is essential to avoid obesity, joint problems. That's why you need APA to ensure that there are no complications further down the line that may lead to a loss of weight. Now, this is Hippocrates. It's quite an old adage. Food is the main medicine. It's really a basic. Thank you.
Merci beaucoup. Non, je vous
Thank
disais,
you very
c'était
much. Now, I've just said that it was really perfect, crystal clear.
C'est un aspect de la prévention et merci beaucoup encore une fois.
It's really an essential aspect of prevention, and thank you very much for being with us today.
Et puis, on va en profiter pour vous
We're
remercier,
going to look at another presentation, and let me thank you, Barbara, because you've been supporting us since the very start, not only for symposiums, but also at other times to help us in a very selfless way.
Eh ben, bonjour à tous, moi je suis Barbara Bringuier.
Hello, everybody. My name is Barbara Bringuier. I'm the regional director of French overseas territories, and I was lucky enough to meet your representative not that long ago. So I'm also in charge of the international department of the Petits Frères des Pauvres, which is a network of associations of non-profit organizations in many countries in the world. And I'd love to meet counterparts because there's a lot we can do together. Now, let me tell you about social isolation and sports. And I might repeat things that have already been said. So at the Petits Frères des Pauvres, we fight the social isolation of people over 50 who face hardship. We'll see that insecurity or hardship is also a cause of social isolation.
Qu'est-ce que l'isolement social?
Now, what is social isolation? It's not only about being on your own.
On peut être seul au sein d'une institution ou dans une
You
maison
can
de
be
retraite.
also lonely in an institution, like in a retirement home. Social isolation is the fact that you don't have a lot of social connections. So there's the number of social relations, but their quality as well. Someone may be isolated, even though a caseworker swings by or the cleaning lady. People just swing by. They don't really stop or have a cup of tea with people in their homes. So the quality of relations here is essential. But there's also the issue of social interaction or engagement, that is being able to do something with other people, being able or having the opportunity to go out. So it's very important for people to know that they can rely on someone, that they can call someone just in case, but also that other people can count on you. For example, you know that you can call Margaret because you need to water your plants for your flowers, for example. It's very important. Now, you might have already heard it, but social isolation is as adverse as obesity, or as smoking 15 cigarettes a day, or as having severe diabetes. So you can actually say that social isolation is a condition, a disease, and that it's essential to find the right remedy. Now, there are many different causes. As people grow older, they lose their family network. So either they become, widows, others might become widows. And a lot of women live in isolation because they have a longer life expectancy. Also, you lose your friends because as you grow older, your social circle diminishes because your friends die, or simply because you have lost autonomy and you cannot go out there and meet your friends. Also, there's economic instability or insecurity. People who have less than 1,000 euros a month in terms of income are twice as exposed to the feeling of isolation. Why? Because they can't afford to go to the cinema or to pay a membership for a gym, for example. So it also limits the number of interactions. And when people face hardships, when their home is not that great, people are not really inclined to invite their friends over for tea. So it also has an impact. And also, there's a lot of depression amongst senior citizens, and that's also a cause of social isolation.
So social isolation and physical health are obviously related. It's what we heard this morning. It's kind of a circle. Everything is related. Bad nutrition, you don't go out anymore, you're isolated, you're losing your autonomy, and your physical health is being damaged as well. So we all know that muscle and bone health is important. It's important to increase good cholesterol, decrease the bad one. Because as soon as somebody feels better physically, they can keep doing their daily tasks. Even if it's just going out to buy bread, for instance. It's important for your morale. It's important for your mental health. And we saw that during the lockdown. When the elderly were prohibited from going out to buy 2 or 3 things from the shop, it had a dramatic impact on them. And it's also important for mental health, of course. As you know, physical exercise increases mental health, well-being. It improves your cognitive functions, your memory. It reduces your stress levels. So you're all very familiar with that. And it also delays dementia. People who are in better physical shape aren't as subjected to dementia or all kinds of Alzheimer. And depression as well. Physical exercise also improves your social well-being because you still have social relationships, even in a nursing home. I can't remember where it was in an island maybe. If you make the decision today to be part of a group that takes part in some gymnastics exercises, it increases your sense of belonging, your sense of being part of a group, having people who matter, having people who are going to worry about you if you're not there. So it increases the amount of people who know you and who care for you as well. So in a nutshell, increased autonomy, better social relationships, and better mental health thanks to physical activity and exercise. Now at the Petit Frère, we try to promote physical exercise amongst the elderly. We try to educate, encourage. It's important to remind everybody of the importance of physical exercise at all ages, because people might tend to think that, oh, I'm old, it doesn't matter anymore, whatever. But no, it's important to remain active at all ages, and also amongst the younger generation. It also facilitates your daily life if you are more active. So that's what we try to do. We also promote exercise on chairs, like you've had in the break just before. That's very important. And it's very important to have people who support you for that. So that's what we try and do as well. And when you're 80 years old, it's complicated to do a few movements sitting down on your chair. So we try to help them do that. I also put some obstacles here on the screen. Obstacles to physical exercise. I think that the Friends of the Elderly are changing these concepts now, but basically our urban environments are often ill-adapted to the elderly. If there isn't any bench between some elderly person's home and the bakery, well, that person might say, I'm not going to go to the bakery anymore because it'll be too far. I won't be able to make it without a bench in between. Same thing in Paris. If you take a look at the state of the pavement in Paris, it makes it very complicated for people with disabilities or for the elderly to keep being active. There's also a lack of urban transport and a lack of physical activity offerings for the elderly, or they're not inclusive enough. Yoga, for instance, often targets the under 30s, and it might seem strange to have somebody who's 70 years old taking part in that yoga class. So how do we ensure that these people feel well, feel welcomed in these classes? That's not easy. So what do we do worldwide? When I say worldwide, this is where we are present, our international network, 24 nonprofits in 24 countries, Canada and US, Mexico, Haiti. We're very present in Europe, Germany, France, Romania, Switzerland, Ireland, Poland, Spain, Greece, Hungary, and Belgium. We are also present in Burkina Faso, in Côte d'Ivoire, and in the DRC. And we're also present in India and in Vietnam. So when I say we, it's actually a network. We're not like Siel Bleu. We actually support independent nonprofits fighting against the isolation of the elderly living in vulnerable situations. So we support these nonprofits by integrating them into our network. And we now have increased demand for that in the developing countries, because there's demographical transition in these countries too, with an aging population in Africa and in Southeast Asia. So we try to support the elderly by going to visit them and also by taking them outside so they can keep being present within their communities, within their neighborhoods, so they can exchange with other elderly, with the volunteers of the Petits Frères des Pauvres as well. So we want to put life back into life. And it's also a virtuous circle, because if you take part in it, just like sport, once you start going out, you want to go out more often. And it increases their health. It improves their health as well. So their sport, nutrition, all of that is taken into account. So we try to ensure that all our volunteers pay close attention to that. So what do we do worldwide? Just a few examples. In Mexico, we offer soft gymnastics in the Casa del Dia. They welcome elderly people in 7 different places. And they always have a session, just like the one that we just saw now. Gymnastics on a chair, or also what you saw in the German video with the throw in and catch with the ball. In Ireland, we have a Wednesday club where the elderly can dance, sing, socialize. Dancing is the best of sports, as we say. Good for your mind, good for your body. In Belgium, we have our volunteers that take the elderly out of their homes to walk around in their neighborhood. In France, we do many things as well, but this year we will organize an Old Olympiades, so the Old Olympics, together with you to improve physical exercise. I want to use the opportunity of the Olympic Games in France this year, and I want to disseminate the following message. We want to say that sport is not only limited to athletes or young people. Sport is good at all ages. And in Haiti, we also have physical activity on chairs that is organized. So that's just one of just a few examples of what we do to fight against the isolation of the elderly. Thank you very much for your attention. Thank you very much, Barbara. And we'll now listen to the testimony from Professor François Carré, cardiologist at the University Hospital of Rennes. He will tell us more about sedentarity. Sedentariness. Good morning. First of all, I apologize for not being able to be here with you for this seminar implemented by the Siel Bleu non-profit for a more preventative Europe. What they do is very important, and I was asked to provide a small presentation, a very brief presentation on the issue in front of us. We are facing a tsunami of lack of physical exercise, of sedentariness. We spend too much time sitting down. It's an addiction to a chair, basically, that's being developed, and that chair is a silent killer. That chair is a factor of chronic disease that is itself a factor of 40 to 50,000 deaths in France. And it targets all ages, and we are very concerned about the youth because the physical abilities of young people keeps decreasing and continuously. An 11-year-old now takes more time to run 1 mile than a 65-year-old in good shape. There's also more diabetes, type 2 diabetes and obesity within the older adults. Teenagers now all say, oh, I can't be bothered, I'm depressed, I'm bored. When the solution is simple, the solution to all of these feelings that we all are fall victim to is to stand up and to be more active. If you stand up and if you are active, especially with other people, you're not bored anymore, you're not depressed anymore, you're not tired anymore. So there's hope here, nothing is lost, it all depends on us, we just need to stand up and move. So let's wake up. Thank you and have a great seminar. And one final message now, which is very important to us in Siel Bleu, an example of a project for active mobility, which is basically using your legs or using a bicycle for small distances instead of a car. So that's the kind of project that we're working on, and we wanted to show you a small video that was done by public transport in Brussels. In a world where to go faster, you don't move anymore. You're stuck on a bike that doesn't move with music that you pay to listen to. In a world full of absurdity, there is a light of hope. Brussels Fit. Brussels' biggest gym. 161 square kilometers. 260 kilometers of cycling lanes. Aircon. Showers. Well, not always. And animals are accepted. Look how cute this one is. Brussels Fit. The first gym without any subscription, available day and night. It's open, its doors are always open because there aren't any. Become a member now. Get on your bike. We thought it was a good approach by the Brussels authorities. And we also have a colleague, Simmoneau, working on active mobility. Sébastien Simmoneau, working on active mobility. He will tell us more about what they do. Good morning, Sébastien Simmoneau. I'll tell you a few words on Siel Bleu's commitment to the environment, especially through what we call planet well-being, with examples of projects that we undertake in France to change behaviors around soft, sustainable and active mobility. So concretely, let me give you two examples. First of all, the EcoHealth project. EcoHealth is the first big project that was conducted between 2019 and 2023 in France, and it raised awareness to about 40,000 participants, people who are retired with chronic diseases or living at home. And that took part every week in our adapted physical sessions, adapted physical activity sessions. So that EcoHealth program given lessons on eco-mobility, but also workshops on walking, on cycling, and daily tasks. The results of that program were very promising because we noted a decrease in 7 percentage points in the use of cars to favor walking, especially for the short distances of under 3 kilometers. And more generally speaking, amongst the 40,000 participants within the program, there was, on average, a 10% energy saving especially by using your car less. And that amounted to 658 megawatt hours of energy saved. That's 27 times driving around the world in an internal combustion engine car. Second example, I'll tell you about Just in Move. So the Just in Move project is a project that is going to start this year in September. And it will go all the way until 2026. The goal is to change mobility practices of the employees of nursing homes. 100,000 employees are targeted in 2,400 nursing homes in France. I don't know if you're aware of this, but this week is the Quality of Life at Work week. And quality of life at work is one of the objectives of the Just in Move program. We will offer awareness-raising actions in all of these institutions to take care of their employees, to take care of the carers who themselves take care of the more vulnerable people in nursing homes, in hospitals, people with disabilities. So very concretely, what are we going to do with Just in Move? 18 hours of awareness raising that will be disseminated through 5 thematic workshops to encourage sustainable and active mobility on a daily basis for your trips from home to work, and also to improve their quality of life at work and reducing occupational health related issues, reducing occupational incidents, decreasing musculoskeletal issues, improving mobility at work, and also workshops with games to talk about the mobility issues and solutions that exist locally. Whether you're living in an urban or rural environment, there are many mobility solutions that do exist. So we're going to use board games for that in one of the workshops. We will also have one workshop on sustainable mobility subscription with an escape game. Sustainable mobility subscription is one tool to improve the active mobility, because through that subscription you can fund from 300 to 800 euros the best practices in terms of sustainable mobility for your daily trips. And we will also have practical workshops, of course, walking, cycling, to remain active. And we will have one workshop on actions that can be undertaken at an individual level in your daily life to rethink the way in which you move. Because being active is good for your health, but it's good for the environment as well. And it's good for your wallet. It's good for your quality of life, basically, as a whole. So that's what I wanted to share with you on that project, and I'm running out of time. So thank you very much and enjoy the end of your seminar. Well, that's it, the end of today's conference. So we tried to convey a few messages today. I think they were clear. And instead of ending with words, we'll end with another active break. Ingrid and Stéphanie, if you don't mind coming back to the front. Thank you.
Right, there's something that you might not be aware of, but usually we do this in a circle when we organize classes, so that we can see every participant. So we're going to slightly edge forward to the edge of the chair and then come back. So you try to move forward all the way to the edge of your chair and then do the opposite movement. So it looks like a cha-cha. You can also slightly take your heels off the floor and do the same. So edging forward and backward. Okay, that's great. Thank you very much. Now make sure both your feet are really resting on the floor. Now what you're going to do is you're going to put your right hand on the outer part of your leg here and try to turn around. Try to open the chest and take a deep breath and come back. Now the other side. So really trying to use this hand. It's going to, you can use it to turn around and back. Okay. Now you can try and loosen up your shoulders. Now take a deep breath. And we're going to roll down the back. So we start with the upper back, the middle part, the lower part, all the way down. Now you let your arms dangle like that. And also try to relax your neck, the nape of your neck. You can also slightly take your feet apart if it makes you feel more comfortable. And just stay in this position for a little while. Breathe in, breathe out. And careful. Here you can put both your hands on your knees and you're going to slowly come up. So all the way up with your shoulders and head at the very end. Let's do it again. So take a deep breath and lower yourself. And now back up. And with your shoulders and head last. So make sure your bottom is at the front of your chair, and now you can stretch like that. We're going to do like just when we started. And try to stretch your legs as well, to stretch your calves. And back. Loosen up your shoulders and thank you. Thank you very much. Thank you also to all our remote participants. If you have questions, feel free to ask them.